Ministerial Statement, Minister for Health.
Thank you, Mr. Deputy Speaker. I rise to update the Honourable House on the ongoing response to the national poliovirus outbreak in Papua New Guinea, which was officially declared on the 15th of May 2025. Mr. Speaker, PNG had maintained its polio-free status since 2000. However, on 4th of April this year, environmental surveillance in Ley detected poliovirus. Genetic testing confirmed it originated from a strain circulating in Indonesia, indicating cross-border transmission. Subsequent detections in Port Moresby and among 2 healthy children in Ley prompted the government to declare a national outbreak, with 13 million Kina committed under the NDC Decision number 99 of 2025. Mr. Speaker, to date, 48 cases of acute flaccid paralysis has been reported across 11 provinces. Of these, 20 tested negative for poliovirus and 28 remain under investigation. Environmental sampling has intensified with bi-monthly collections in Ley and Port Moresby. Additionally, surveillance sites have been set up in Mount Hagen, Goroka, with plans to expand to Mereng. Mr. Speaker, an incident management system has been activated under the National Emergency Operations Center, and a detailed outbreak response plan is guiding coordinated efforts across our country, focusing on surveillance, immunizations, logistics, and risk communications. Standard operating procedures have been disseminated to all PHAs in our country. Mr. Speaker, the primary objective is to protect children from paralysis and prevent further virus transmission. The vaccination strategy includes, firstly, the IPV, or inactivated poliovirus or vaccine, for children under 5 in Ley and Port Moresby. Secondly, 2 rounds of NOPV2, that is novel oral polio vaccine type 2, for children under 10 nationwide. Spaced 4 weeks apart, IPV will be administered during the second round. So we'll be looking at vaccinating around 4 million children under the ages of 10 years. Thirdly, routine immunization will be strengthened through integration of the campaign and pre-post campaign outreach activities. Mr. Speaker, the first national campaign is scheduled to begin on the 21st of July 2025, with vaccines of about 4 million vaccines to be arriving between 16 to 20th of June this year. The estimated cost for the 2 rounds of the campaign is 88 million Kina. So far, 74 million Kina has been secured through the 13 million Kina from our government. Thank you very much to our government for the fast, quick response. The 5 million Australian dollars from the government of Australia. We thank them for their continued support to the Department of Health programs. $11.8 million from the Global Polio Eradication Initiative, and technical and logistic support from WHO, UNICEF, including a full cost of NOPV2 vaccine supply. Mr. Speaker, during the recent World Health Assembly in Geneva, I presented PNG's national statement reaffirming our commitment to the Global Polio Eradication Initiative and in advancing or advocating for cross-border coordination, especially with Indonesia. Mr. Speaker, all PHS have been instructed to activate their Emergency Operations Center and intensify surveillance and immunization drives. Urban centers are conducting catch-up campaign as we speak, but strong provincial leadership and funding are essential to scale operations effectively. A national advocacy and media campaign is underway, utilizing radio, television, and print to inform, mobilize the public, and key messaging materials, including frequently asked questions, have been developed for community outreaches. Mr. Speaker, the genetic link to the Indonesia strain highlights the urgency of strengthening biosecurity capacity at the PNG-Indonesia border, as I've stated yesterday. We must scale up surveillance and immunization at these points of entry through the coordinated efforts by the Department of Health agriculture, defense, immigration, and border security to prevent future cross-border transmissions of polio and other infectious diseases. In conclusion, Mr. Speaker, the outbreak is a sobering reminder that as long as polio exists anywhere, it remains a threat to all of us. Our collective responses, led by the Ministry of Health, supported by the international partners, and implemented by our dedicated provincial teams, must be swift, unified, and comprehensive. I call on every honourable members of our House to actively support vaccination and awareness efforts in our constituencies. Let us work together to protect our children and preserve our PNG's citizens. Thank you, Mr. Acting Speaker.